So, this week I wanted to talk a little bit about different types of ethical challenges that we as healthcare professionals will face in healthcare. There's so many types of ethical challenges that we just don't know how to deal with it, and we want to deal with it as good as possible and make a positive experience out of it. But sometimes it can just be very challenging. So I just want to talk about different ones because this week we are talking a little bit about HIV and pregnancy. So, as a healthcare professional, you're going to see several different issues where patients might ask your opinion about things. So, one of those might be the HIV and pregnancy thing. So, you have a patient that is pregnant and has HIV. Well, this is a very touchy and personal situation, and this is something that you, as a healthcare professional, should not actually set your opinion to for the patient, even if they ask you so. It's something that the patient must learn to decide on their own, and also with family. So that any type of situation that involves like a life and death situation and things like that, that is an ethical challenge for many healthcare professionals, especially if their opinions are requested by the patient. Okay, and as a healthcare professional, to be respectful, we have to not give them an answer. It has to be their decision. It has to be what they feel is best for them to do, for themselves and for their families. Okay, so that is definitely a situation that you may see a lot, especially if you work on the clinical side of things. Nurses see that quite often. Another one would be an ethical situation that we see is balancing profit with serving patients and with charity. So, for example, nurses are very scarce. Sometimes we lack a lot of nurses, and we need them. They're very important. They give the patients, not only the care that they need physically for their health, but also emotionally. Okay, so it's very important that we weigh as healthcare professionals the benefits of our job with the salary as well. So you don't want to always just look at, oh, well, this job is paying me, $10,000, $20,000 more. I don't think I'll like it as well, but I'm getting that extra money that I'd really like to have. So, we don't always need to focus on that part. A lot of times we need to focus on, hey, this is not what it's all about. It's not all about the money. Do I enjoy this? Is my heart in this job? Okay, so that is sometimes an ethical challenge that we face. We have to look at, is this something I enjoy? Is this what I really want to do? Or am I just doing it for the money? Okay, so that is a common ethical challenge, not only from, nursing perspective, but from a provider perspective or any other type of healthcare professional. Another ethical challenge that we see a lot would be wrestling with equal treatment from influential people and family members. Okay, so I want to talk a little bit about that and explain what that means. So, say that you get a patient that comes in that is your neighbor, okay, and you really like them. They're very sweet. They've done a lot for you, so maybe you try to give them more of your time than you do this other patient that you don't know them at all. They're just your patient. You have no personal relationship with them. So that is definitely an ethical challenge that we face. Setting standards for someone that we know and not setting them for someone that we don't have that personal relationship with. So we just can't do that. We have to treat everyone the same. We have to provide everyone the best care possible, the best quality care, because that is our job. No matter who they are, we are to provide them the best care. Okay? Another one would be addressing nurses' moral distress about providing care with minimum benefit. So this is something that is definitely an ethical challenge for many nurses. This means dealing with patients that are pretty much on their deathbed and they are still wanting to live. They're, do not retest, they are just wanting to have that life and continue going, but the nurse knows that they are at the end of their time pretty much. So a lot of times nurses and other healthcare professionals, doctors as well, get very frustrated with patients that are pretty much just a vegetable laying there in a hospital or a nursing home or whatever, and can't do anything for themselves, can't feed themselves, can't take a shower, can't do anything, but they're still there, and they're still a living being. So this is an ethical challenge because a lot of healthcare professionals, need to have patience for these patients. Patience meaning they need to understand that this is still a human being. They still want to live just like you and me. So, that is an ethical challenge. You have to take care of someone that, probably might not live a month or a year from now just as well as you do someone that has that benefit of living years and years. So it's definitely a challenge, and it's something that we have to accept and do because that is our job. Okay. If you have any questions this week, feel free to contact me. Thanks.